Pelvic tilts are one of the first things that so many of us as physical therapists teach our patients. However, pelvic tilts are usually the first thing that patients are confused about. So with this being such a key motion that patients need to learn, it's really hard to increase buy-in and build a proper relationship with our patient if they're starting confused. So in this video, I want to discuss 4 primary reasons as to why pelvic tilts tend to confuse patients. My quick disclaimer that you're probably aware of is that pelvic tilts can be in the anterior or posterior direction. Now, what you ultimately need to coach depends on your patient's structure. In this video, I am just going to talk about the posterior pelvic tilt. Usually this is the more common one that patients need to move into, and also it's seen in dead bugs and a lot of abdominal exercises. So it tends to be more common. However, there always is a place and time for an anterior pelvic tilt. Now let's go to the problems. Problem number 1, patients don't understand the value. So when your patients come in and they tell you how busy their day is, how they have no time to do anything, good luck trying to get them to perform a posterior pelvic tilt exercise if they don't understand the value. The first thing we need to do before we show them anything is to tell them why this move is going to positively impact them. Once they understand that, then we need to show them. But you can't show them unless they know the why first. So we need to start with the why. So here's a quick example as to how I like to increase a posterior pelvic tilt buy-in. Hey, Mr. Jones, how's it going? My name is Dr. Brian Larish. It's great to meet you. What we're gonna do today is we're gonna start with an exercise. The exercise is a posterior pelvic tilt, but I don't want you to actually care about that name. What I want to do is to show you an exercise that is going to help get rid of your back pain that you've been dealing with for 20 plus years. How does this happen? Well, think of it like this. If you think of a house, every house has a foundation, right? Every house has that foundation, and then we have a first floor and a second floor that it's built on. Well, imagine, Mr. Jones, if that foundation was slanted or that foundation was cracked. How do you think the first and second floor would respond? Ultimately, we'd probably have problems, right? So when it comes to the human body, you have 2 foundations. Our pelvis, which is here, which is commonly referred to as our hip bone, and our rib cage. And a lot of times, they are not stacked over one another. So you can imagine, again, back to our house, if the house had a foundation, the first floor was built off of that foundation, there would be problems. Same thing with the human body. So what we want to do is to show you a move so you can get the ribs stacked over the pelvis. This is going to establish a good foundation. Once we have a good foundation, then we can really start to get rid of your back pain by you not putting it in a position for it to overwork, but also now we have a foundation to really build strength on. So hopefully you found that helpful, but in all seriousness, now Mr. Jones understands the value because we put in terms that they're familiar with. Most people are familiar with a proper foundation builds a proper house, and any sort of dysfunctional foundation builds or creates dysfunction throughout a house. When it comes to the human body, the rib cage and the pelvis are our human foundations. We need them to be stacked on top of one another. Most people come in that need to posterior pelvic tilt are living in this extended position where you have an asynchronous position here. We need to create synchrony and stack it before we actually start to move forward. Problem number 2, patients don't understand what to feel. How many of you have gone through this scenario? As your patients going through their exercises in the clinic with you, they say they feel it, they understand it, everything looks great. Then when they come in for their next session, they tell you that, yeah, I was doing that exercise that we were going over, but I didn't really feel it the same. So I just stopped and I haven't done anything in about a week just because I didn't feel it. I wasn't sure about it. Super familiar, right? We need to make sure that we're giving patients tools so when they're not with us, they can be successful. So how do we do that? Well, we need to make sure that they feel what they're supposed to feel, because a lot of times patients actually don't feel it in the right spot. So when it comes to a posterior pelvic tilt, try the number scale. So what I like to tell patients is that they need to feel a little bit of abs, a little bit of abdominal or stomach tension when they move in to that posterior pelvic tilt. And as a physical therapist, we know that as we go into that motion, the rib cage depresses, the pelvis goes posteriorly, we should pick up a little bit of abdominals. So how do we do this from giving them a tool? That's where the number scale comes in. Tell your patient, I want you to imagine a number scale. We have a 0 to 10. 0 is no ab tension, so we're sleeping. 10 is the most amount of abs you've ever felt in your life. When you go through your posterior pelvic tilt, I want you to find and feel about a 1 or a 2. So we should feel a little bit of stomach tension as we go through that motion. So when you're at home, if you don't find your 1 or 2, we're not in our posterior pelvic tilt, or we're not in our tucked or tilt position, however you described it to them. This is so simple, but gives them so much power, because now they know at home, I need to feel that. Once I feel that, then I go to the next steps. This will help your patient truly learn how to start to posterior pelvic tilt. Problem number 3, patients don't internally rotate their ribs. Can you spot the problem with this? If I go down into a position for a posterior pelvic tilt, can you spot this problem? Did you see it? I went into a posterior pelvic tilt, but the rib cage is still flared. What is this telling you? Well, remember, when we go into a posterior pelvic tilt, the goal is to get more in a flexion biased position. The ribs are attached to the spine, and I think a lot of us forget about that. So when the ribs are in extension, it's telling us the spine is still in extension. So to fix this, we really need to make sure that patients feel the rib cage internally rotate, or it's just another word of saying depress. So when we go into a posterior pelvic tilt, the ribs need to drop as we go into that motion. How can we fix this and put it in a simple way for our patients? We're going to take one hand that we're going to cue as our belt buckle. We're going to take the other hand and throw it on the lower rib cage. The patient thinks two things. We want to move our belt buckle towards our chin. That's going to give you the pelvis motion. And then we're cueing them to exhale until they feel their ribs go down. Not you should feel, you must feel. They need to feel the ribs go down on exhalation. So many of us go through a posterior pelvic tilt exercise like a dead bug, and we're still in an extended posture, even though they might have felt that posterior roll. So when we play it out, we have our belt buckle hand, we have our lower rib cage hand. Belt buckle towards the chin, and then we're going to take an inhale and an exhale until I feel this hand drop. That is our posterior pelvic tilt position. Problem number 4, patients don't have the proper awareness. A lot of times as patients are going through any sort of posterior pelvic tilt exercise, they often don't recognize when they lose their position and start to compensate. Here's the nice thing. You've already bulletproofed that from happening from the previous steps that we talked about. Let me show you. As you go down the hook lying position, remember our patient already has a better increase in perceived value of this exercise. So they're going to start in a better mindset. Number 2, we gave them the proper tool so they know how to feel when they lose it. That's our number scale. So as they go into that posterior pelvic tilt direction, they're finding their 1 or 2. They're remembering that as they go to the next step. Then we said step number 3 was getting that belt buckle to maintain in that towards the chin position and getting full depression or internal rotation of the rib cage through a proper exhalation. Now we've set them up for success. This person can go home and be very confident and successful when doing a posterior pelvic tilt because we gave them a checklist and we gave them the proper reference points for them to be successful.